Hello friends, welcome to Dr.Bone YouTube channel. Myself, Dr. C. Shivanatsumareddy. Today we are going to talk about a spine topic. That is, what are the different types of spine injections and when to give which injection? These are the two questions which we are going to talk. So firstly, what are the two types of spine injections which we regularly give in our hospitals? First one, that is epidural steroid injection, and the second one is selective nerve root block injection. These are the two types. And when we are going to give epidural steroid injection or when we are going to give this selective nerve root block injection. So before knowing about these two types of injections, I'll try to explain with a bone model. First one. So this is our spine bone model. This is our front view, that is anterior aspect, and this is posterior. These are the two vertebrae, and this is our disc, intervertebral disc. So, and here we have one small gap which we call that as spinal canal. So within this spinal canal, the spinal cord will pass. And can you see this? Can you see this? That is spinal nerve. Spinal nerve comes out within this gap, which is called as intervertebral foramen. So this spinal cord will pass through spinal canal and this spinal nerve which passes through intervertebral foramen. Whenever you have a problem related with the spinal canal, normally the spinal canal will have a gap of 15 mm. So because of some reasons, it can be, first thing, it can be degenerative changes that is related to elder patients, and the second problem is whenever you have a disc problem. So this is our disc. Whenever it gets compressed, it can go behind and it can compress or it can reduce the gap of that spinal canal. So whenever you have a spinal canal problem, then we are going to give you epidural steroid injection. Okay. So second one, when we are going to give this selective nerve root block injection, we are going to give selective nerve root block injection whenever there is a compression over this spinal nerve. So we are going to give epidural steroid injection when you have a problem in the spinal canal, and we are going to give selective nerve root block injection whenever there is a compression on this spinal nerve. So the regular other question which the patients keep on asking doctors is, sir, how many injections we have to take and how frequently we have to take? So there is only one thing. Whenever we give injection and if you feel better, then you can take any number of injections, but you have a proper duration, and whenever you feel comfortable, you can just skip it off. Suppose a patient came to me and I have given one epidural steroid injection and he feels better for 6 months, 1 year, 2 years, 3 years. Then how I follow is I never give them again until they complain of severe pain. So if he complains severe pain after 6 months, then only I'll advise him to take another epidural steroid injection, or it can be selective nerve root block injection. And there is no rule like you have to take only these number of injections. But I don't recommend any injections whenever you have severe canal stenosis or even you have other issues like with the disc, intervertebral disc, like disc extrusion and disc sequestration. So in these conditions also I don't recommend. So you have to consult your orthopedician or neurosurgeon or even a spine specialist. Okay. So I hope I am very clear with what are the different types of injections that is which we are giving to spine. Okay, this should be helpful for everyone. Thank you very much.